Hi guys, welcome to the channel. Over the years, I've spent some time speaking to registered nurses and talking to them about their journey. And it appears that for some reason, some nurses believe that nursing is all about working on the ward, doing shift patterns, doing night shifts, and so on and so forth. In this video, I'm going to be talking to you about some of the specialist jobs that you can do in the UK. Hi guys, my name is Shola and I'm a registered mental health nurse working in the UK National Health Service. On a personal level, I used to be an accountant, and less than 6 years ago I went to university, or less than 6 years ago I qualified as a registered nurse. And since then I've been working as a mental health nurse, I've worked on the ward, and now I'm working as a continuing healthcare nurse assessor. Some people might ask me, what's that? Continuing healthcare, what does that even mean? In this video, I'll be telling you about all of those specialist jobs that you can apply for. I know there are people who used to work in marketing, some people used to work in IT, some people used to work in sales, and they've decided that they want to go and become a nurse. Personally, when I went to uni to become a nurse, I sort of thought about how can I make my nursing degree count? What else can I do with my nursing degree while I work as an accountant? And what I did was I tried to look for areas in nursing where I can bring some of my accounting knowledge. And that's how I found the CCG, the Clinical Commissioning Group. And the role of the CCG is to plan, buy care for the local community. Okay? If you get any value from this channel, please don't forget to like, share, subscribe. One of the things I will say is that on this channel, we aim to help you to make your money go further. And how do we do that? We tell you information about things like salary sacrifices, tell you about things like tax relief, tax rebate, and many more. Also, we look at nursing, the area of nursing. What can we do to make our money go further? You know, what can we do how do we learn about reflective practice? How do we learn about, what nursing, day-to-day nursing roles are? Again, I'm on TikTok. So Nursing Meet Finance on TikTok, on Instagram, Nursing Meet Finance. Again, there's a significant amount of people that is watching this channel that are not subscribed to the channel yet. So please, I'm going to stop, take a minute, and I want you to just go down, press the subscribe button, press the like button, and press the post notification button so that every time I upload a video, you will get a notification so that you can watch those videos. And I hope the videos are giving you value. Again, 15 specialist roles that you can apply for in the UK. So the first role that I will say is that if you're a learning disability nurse or LD nurse, one of the roles that you can apply for is the leader review role. I mean, what does leader mean? Leader looks at learning from death of people with learning disability. You know, people that have got learning disability that have passed away. What we want to do is look at what could have been done to increase their life expectancy. What could have been done to avoid their death? So leader review is a band 6 role that you can look at, and if you're an LD nurse, you need very minimal training with this, and it's a specialist role that you can apply for. One of the good things about being a nurse is that nursing is very versatile. Again, research shows that in 2022 alone, 1 in 3 nurses will leave the profession. This will either be because they're burned out, they're retiring, or they're moving to something else. Again, with the pandemic and with the current climate in nursing, it's always good to know that there are other roles that we can apply for, and this nursing is not limited to just just long days and night shift and so on. You can work in the pharmaceutical company, you can work in the travel industry, you can work in the aviation industry, you can work in the marketing industry. There's so much that we can do as nurses, and it's very important that we know that this information is available out there. As mental health nurses, we can work in the community as a CPN, community psychiatric nurse. Another thing that we can do is we can specialize in the area of CAMS, child and adolescent mental health service. Working in the community as a CPN, you might be going to people's houses, working 9 to 5, having your own caseload, working autonomously. I mean, these are some of the things that we can do. I mean, some people will decide that they want to stay on the ward, they want to move to a metro role, to a clinical nurse lead role, but again, it's very important that we know that there are roles out there that we can apply for that does not limit us to working on the ward. And I think having this information can help reduce the burnout rate. So what are some of the other roles that we can look at? Again, I said I work as a CHC nurse assessor. This role can be done by anyone, either a physical health nurse or a registered general nurse, a mental health nurse, or learning disability nurse. And what does that role entail? The role involves us completing an assessment of needs. You're looking at people's behavior, their cognition, their skin, their mobility, their nutrition, and so on and so forth. So again, that's another role that we can apply for. There are people who work as travel nurses. They go around the area. Some people work for Goldman companies. Some people work for British Airways. Some people work for private companies where they do things like occupational therapists and so on. So there are loads of roles. I've got quite an extensive list of roles that we can do. We can work as a nurse practitioner. We can work as a community liaison nurse. We can work as a nurse prescriber. A nurse prescriber works hand in hand with the general practitioner, the GP. And what they might be allowed to do is that following their examination, following their further development, remember nursing is about continuous development, continuous learning, continuous development. You might go to university or go and do a course that allows you to prescribe medication. Again, you find yourself working hand in hand with a GP, supporting them on a day-to-day basis. Another role that you can apply for is the role of a triage nurse. A triage nurse works in accident and emergency department, and when you go to A&E, you've broken your leg, you're sitting down there patiently waiting for 2 hours for somebody to see you, and then you're sent to a room to go and speak to a nurse. And what that nurse is trying to do is trying to see, where can your needs be best met? Do you need to go to the A&E and see the doctor, or do we need to refer you back to the GP, or do we advise you to call the 111 service? Again, that takes me to another role. You can also work as an NHS 111 triage nurse. That means that you sit in an office, you're receiving phone calls from people who are either physically unwell or mentally unwell. And what you're doing is you're trying to signpost them to the right areas. Some of the other roles that I've got here is prison nurses. Nurses, physical health nurses, mental health nurses, learning disability nurses can support the custody nurses, can support the prison services. So many things that we can do as nurses. Like I said earlier on, nursing is very, very diverse. And what we need to do is not limit ourselves to working on the ward. There's more to nursing than just working on the ward. Again, I've got custody nurses, I've got pediatric nurses or school nurses, I've got disability assessor. When you work as a disability assessor, you might find yourself working for Department of Work and Pension, doing what they call PIP assessment, disability assessment. Again, there are private organizations such as ATOS, Capital, that recruit for disability assessors. And in this role, you're using your nursing skills to make decisions about the individual's needs. So much that we can do. Again, research nurses. You can work as a research nurse. There's still clinical trials going on for Parkinson's disease, for dementia, for so many things, so many research going on out there that you can get involved in. Another role that you can apply for is the role of an expert witness. We can work across the board. Expert witness might be working for a legal firm. Might be working for a legal firm, and they say, come to court with us and give your expert knowledge about this person's condition or about this person's outcome. So, our expertise are needed across the board, okay? You can also work as a lecturer in the university. If you're prepared to go through professional development, either through completing a master's degree, you might be able to work as a lecturer, actually teaching the up-and-coming nurses, engaging with student nurses, actually mentoring them, tutoring them through their journey. Some of the other things that I've got here is working as a CAMS nurse, community child and adolescent mental health service nurse. You can work for NHS England. You can work for CQC. Okay? I've got an extensive list here. You can work as a discharge coordinator. A discharge coordinator's role is to, when somebody is ready to be discharged, to actually find out what is the best discharge route for them. Do they need to go into a nursing home using what they call the discharge assessment? And then they can have an assessment later on in the future. If they're going in the community, they need to be referred to a district nurse. Again, another role that you can apply for is the role of a district nurse. So many things that we can do here. You can work as a diabetic specialist nurse, epilepsy specialist nurse, respiratory specialist nurse, and many more. Within the UK, there are a vast amount of roles that we can apply for. Guys, I hope you're getting value from this video. If you like what I'm saying, if you like what I'm talking about, please don't forget to like, share, and subscribe to the channel. Again, remember that we've got TikTok. Check me out on TikTok, Nursing with Finance. I've got Instagram. Check me out on Instagram at Nursing with Finance. I hope you get value from this video, and thanks for watching. Thank you.